End of Life Care, Chapter 21. In this chapter, you will learn how to define the key terms and key abbreviation, describe palliative care and hospice care, describe the factors affecting attitudes about death, explain how to meet the needs of a dying person and family. What is end-of-life care? End-of-life care describes the support and care given during the time surrounding death. Death may be sudden or expected. Some people gradually fail. It may involve days, weeks, or months. According to the National Institute on Aging, most people die in hospitals or nursing centers. Terminal illness. Terminal illness is an illness or injury from which the person will not recover. For example, cancer. Many illnesses and diseases have no cure. The body cannot function after some injuries. Recovery is not expected. The disease or injury ends in death. Persons with terminal illnesses can choose palliative care or hospice care. Palliative care focuses on comfort and support to improve quality of life. It can be offered at any point of person's illness. Hospice care. This focuses on providing comfort care to people who are dying and supporting their families. Comfort care keeps a person comfortable, but that doesn't prolong life. For example, the nurse can provide oxygen, administer pain medication, and personal care. DNR, do not resuscitate. This means that the healthcare worker should not start CPR if the person stopped breathing or the person's heart stopped. You must notify the nurse. Core beliefs of hospice model of care. Dying is normal. It is an expected part of life cycle. Dying should not be separate from support system like family. Care for the dying must be addressed physically, emotionally, and spiritually. Care for the dying seeks to relieve pain and other distress. Assist the dying person with dignity by honoring the person's wishes. Family will need support after their loved one's death. Providing emotional support. End of life is a time of emotional preparation for both patient and the family. It is influenced by culture, spiritual and religious beliefs, past experiences with death, sense of having to live full and a completed life. Grief is an intense sadness that occurs as a result of loss. For example, loss of health or end of marriage and death. Throughout end of life, patient and family may experience sadness. They can also experience fear. This is related to death, fear of the unknown, dying alone, or experiencing pain. For some end-of-life patient, it feels like situation is unfair or that something could have been done to prevent the situation. They can also be in denial. This is when dealing with information that is difficult to accept. However, for some, they believe in hope. At the end, the patient may choose acceptance as a time of peaceful resignation. Patient is at peace with the future and what it holds. As a nursing assistant, the most important skill that you can use when caring for people dealing with end of life is the ability to be a good listener. Respecting cultural and religious customs. Many religions and cultures have their own customs and rituals relating to death. For example, Roman Catholic faith often receive a sacrament of anointing of the sick. Throughout end of life, ensuring patient physical comfort is important. Conditions that patient may experience like pain, shortness of breath, and digestive problems. As a nursing assistant, it is important that you become familiar with conditions and notify the nurse immediately. When providing physical support, always remember that pain is a common feared symptom that occurs when someone is dying. Report pain to the nurse. Ensure that the patient is correctly positioned to help relieve shortness of breath. Shortness of breath and difficulty breathing are common end-of-life problems. Semi-Fowler position and oxygen are helpful. Remember, you must notify the nurse to provide proper intervention. As a nursing assistant, you can provide the following care with the help of a nurse. For vision blurs and gradually fails, secretion may collect in the eye corners. Good eye care is needed. Hearing is the one last functions lost. Always assume that the person can hear. When you provide care, let the person know what you are doing. Speech becomes harder. It may be hard to understand the person. Sometimes the person cannot speak. Remember to always maintain dignity and privacy. Mouth, nose, and skin. Oral hygiene promotes comfort. Oral hygiene is needed if mucus collects in the mouth and the person cannot swallow. Crusting and irritation of the nostrils can occur. Nasal secretions, an oxygen cannula, and a nasogastric tube are common causes. Circulation fails and body temperature rises as death nears. The skin is cool, pale, and mottled. Perspiration increases. Skincare, bathing, and preventing pressure injuries are necessary. Nutrition. Nausea, vomiting, and loss of appetite are common at the end of life. As death nears, loss of appetite is common. The person may choose not to eat or drink. Elimination. Urinary and fecal incontinence may occur. Constipation and urinary retention are common. Enemas and catheters may be needed. In the weeks before death, the following may occur: restlessness and agitation, shortness of breath, depression, anxiety, drowsiness, confusion, constipation or incontinence, nausea, loss of appetite, healing problems, swelling in the hands, feet, or other body areas. As death nears, the following signs may occur fast or slowly. Movement, muscle tone, and sensations are lost. Gastrointestinal functions may slow down. Body temperature rises. Circulation fails. The respiratory system fails. Pain decreases as the person loses consciousness. The signs of death include no pulse, no respiration, and no blood pressure. The pupils are fixed and dilated. Remember, you must notify the nurse if you see these changes. A doctor determines that a death has occurred. Care of the body after death is called post-mortem care. As a nursing assistant, you may provide post-mortem care. Post-mortem care begins when the doctor pronounces the person is dead. Post-mortem care is done to maintain a good appearance of the body. The right to privacy and the right to be treated with dignity and respect apply after death. Within 6 to 8 hours after death, rigor mortis, the stiffness or rigidity of the skeletal muscle that occurs after death, develops. The body must be positioned in a normal alignment before the rigor mortis sets in. When an autopsy is done, post-mortem care is not done. An autopsy is the examination of the body after death. Follow agency procedures for an autopsy. As a nursing assistant, you play an important role in providing care to the end-of-life person and the family. Always remember to provide privacy and dignity even after the person's death. Notify the nurse with any sudden changes. Always practice within your scope. Please refer to your textbook and other video resources provided by the faculty to learn more about end-of-life care.